Hello, I am Dr. Yashdeep Gupta, an additional professor of endocrinology. Today, we will discuss gestational diabetes. Gestational diabetes is when high blood sugar is first detected during pregnancy, affecting 1 in 7 women. It can impact the health of both the mother and baby during and after pregnancy. Gestational diabetes is usually asymptomatic and can be diagnosed with tests. To diagnose gestational diabetes mellitus, a 75-gram oral glucose tolerance test is done between 24 and 28 weeks of pregnancy. Blood samples are taken fasting and after 1 and 2 hours. If results exceed the cutoffs, GDM is diagnosed. Early testing at first antenatal visit is desirable to detect gestational diabetes, as it can present early in pregnancy also. For those with risk factors for gestational diabetes, testing with 75-gram oral glucose tolerance test is advisable. And for women without risk factors, a fasting plasma glucose test can be done early in pregnancy. Gestational diabetes can result from some pre-pregnancy and pregnancy-specific factors. Pre-pregnancy factors include pre-existing conditions such as obesity, advanced age, family history of diabetes, polycystic ovary syndrome, hypertension, or prior pregnancy complicated with gestational diabetes. Further, physical inactivity and unhealthy diet before and during pregnancy can increase the risk of gestational diabetes. Gestational diabetes can affect placental development, leading to complications like hypertension during pregnancy and preterm birth. Gestational diabetes can also impact the development of multiple fetal tissues, resulting in both short-term and long-term consequences. The short-term complications can be large-sized babies, jaundice, breathing difficulties, hypoglycemia, and birth injuries. In the long term, babies can have obesity and diabetes. When women is diagnosed with GDM, they should follow a healthy diet during pregnancy. Consume over 1500 kilocalories per day adjusted for activity, trimester and weight. They should prefer complex carbohydrates with a low glycemic index, avoid juices, cold drinks, chocolates and bakery items. They should have intake of 70 gram of protein daily. They should eat 3 major meals and 3 to 4 healthy snacks. They should include vegetables, fruits, low-fat milk and dairy products. Consume at least 28 grams of fiber daily. Exercise is crucial for managing gestational diabetes. It helps control blood glucose levels, manage weight gain and improve overall health. Regular physical activity like walking for 30 minutes most of the days reduces the need for insulin, enhances cardiovascular health and lowers the risk of complications. Always consult your doctor before starting any exercise regimen. If women's glucose levels are not controlled through diet and exercise, medications are needed. Insulin is preferred, but metformin can be used if glucose levels are not too high and there are no contraindications like kidney issues, slow fetal growth or preeclampsia. No other diabetes medications are safe during pregnancy. For optimal glycemic control and pregnancy outcomes, glucose monitoring is essential. If initial tests show high glucose levels, extensive monitoring such as 6 times a day before and after meals is needed. If glucose levels are not too high and there are no complications, less frequent monitoring like twice a day can be enough. Your doctor can advise on the appropriate frequency based on your situation. Gestational diabetes can also lead to long-term health issues for mothers, such as diabetes, hypertension, fatty liver and cardiovascular diseases, with the highest risk of developing diabetes within the first 10 years after delivery. Recurrence in subsequent pregnancies is also possible. regular screening and staying in touch with healthcare practitioners are crucial. In conclusion, remember these 10 key points with the mnemonic A to J. Assessment. Have your annual checkups for glucose and cardiometabolic parameters. Breastfeeding. It lowers diabetes and obesity risk for both the mother and baby. Contraception. It helps preventing unplanned pregnancy. Diet. Follow a healthy diet after delivery also. E for exercise. It reduces the future disease risk. F. Family. Involve your family members for sport. Goals. Set realistic goals and try to achieve it. Healthcare. Stay in contact with the healthcare providers. I for individualized care plan which is tailored specific to your needs. J for joyful living, get good sleep and reduce stress. Keeping these points in mind, let us begin a fruitful journey to good health. Remember, moms need healthy babies and babies need healthy moms. Thank you. Namaste.